Okay, well, my clock shows that we are at the hour, so we'll go ahead and start. Hi, and welcome to today's webinar, CoverKids 411, Making Up for Lost Ground. The webinar is being recorded and a copy will be emailed to everyone who registered. We'll also provide a copy of the slides that Tricia has prepared to share with us today. If you have a question, please type it into the Q&A box as we go along, and we'll try to answer those questions at the end. So let's go ahead and get started. I'm Kanika Young. I'm the Senior Director of Health Policy and Advocacy at the Tennessee Justice Center. We are proud to have joining us today Tricia Brooks from the Georgetown Center for Children and Families, which we refer to as CCF for short. We have partnered with CCF at the Tennessee Justice Center for several years on what we call the Finish Line Project, which is funded by the Packard Foundation. Our partnership works to educate families and those who serve them about our state's Medicaid and CHIP programs and to increase enrollment and advocate for policy solutions that will expand access for children and improve health outcomes. Our topic today concerns an alarming trend that we notice in our state's CHIP, which is known as CoverKids. The number of children enrolled in CoverKids has declined by about 50% in the past 2 years. These numbers really should be going up now since we know more families are facing financial hardship and losing employer-sponsored insurance as unemployment numbers skyrocket. And so today we are honored to have Tricia Brooks here to speak about the declining enrollment, how Tennessee measures up against other states, and what we can do to help reverse the trend. Before I turn it over to Tricia, I want to get a gauge for who is in the audience. So I'm going to launch a poll. You should see that show up on your screen. So the question is, who do we have in the audience today? Please select whether you work at a healthcare facility or a physician's office, a school or school district, city government, state government, a nonprofit organization, a private foundation, legal services organization, or other. And that'll help us get a sense for our audience here today. So just give folks another 15 seconds to respond. Okay, go ahead and end the polling. And I'll share the results. It looks like most people work for nonprofit organizations. That's good to know. We'll have some information towards the end for how you can get connected and help to reverse the trend of declining enrollment. So thank you for sharing that information. I will stop sharing and close the poll. And so now I will turn it over to Tricia. I'll just briefly introduce her. Tricia is a research professor at the Georgetown Center for Children and Families. She is a member of the Medicaid and CHIP Payment and Access Commission, known as MACPAC. And prior to joining CCF, Tricia served as the founding chief executive officer of New Hampshire Healthy Kids, which is a legislatively created nonprofit corporation that administered CHIP in that state and served as the Medicaid and CHIP Consumer Assistance Hub. She holds a Master of Business Administration from Suffolk University. And so Tricia, take it away.
Well, thank you, Kanika. It's a pleasure to be here, and I am going to share my screen if I can, but it's giving me a message, Kanika. Let's see, host disabled attendee screen sharing. Is that, I'm the co-host now, got it. Sorry about that, the logistics folks. Let me get this screen up. And this is the one that we want to see. And I want to share that. Okay, can you see that?
Yes, we can.
Okay, good. Okay, great. Well, good morning again. And thanks to Kanika and everybody at the Tennessee Justice Center for the work that you do on covering kids. I'm going to start with covering some data just so we can all be on the same page in terms of what has or has not been happening with enrollment in Tennessee for children over the past couple of years. And as Kanika said, discussing how that compares with other states or the nation as a whole. It's helpful to start though by making sure that everybody really understands how your eligibility works for children. This comes from a 50-state survey that we conduct with the Kaiser Family Foundation every year on Medicaid eligibility, enrollment, renewal, and cost-sharing practices. And what you have here illustrates the flexibilities that states have, excuse me, states have flexibility in how they administer their CHIP programs. And I'm sorry, my voice is going to, a little dry throat this morning here. The gold areas show your traditional Medicaid program, and blue is what is called an M-CHIP program. It is where a state uses CHIP funds to enroll kids in Medicaid. And under M-CHIP rules, they are exactly the same as Medicaid, with just one exception. That exception being that the child must be uninsured. And then the red blocks here represent who is actually in CoverKids, which is your separate CHIP program.
Hey Tricia, can you switch to presenter mode to make the slides a little bigger?
Well, let me unplug my monitor because it will do weird things. So I can do, it tries to display it on two screens when I do it that way. I need to move this out of my way. I can't get the box. There we go. Let me see. The box was in my way. So
there it is.
Okay, here we go. So we were just talking about the eligibility levels. I think I've got my voice back now. And where this is important is that there are different rules that apply to separate CHIP programs versus Medicaid programs. But the thing I wanted to make sure you understood is there's a portion of your kids that are funded by CHIP, but they're actually enrolled in Medicaid, in TennCare. Now this is your separate CoverKids child enrollment over the past couple of years. This comes from the state website. One thing to point out here is that in your CHIP enrollment, in your CoverKids enrollment, is also the enrollment of what is referred to as the unborn child option. That is an option where the state can cover from conception to birth. So in essence, these babies in utero are covered, and by virtue of that, their mothers are covered. And so we have excluded those numbers out of this particular graph just so you can actually see the child enrollment. And what you can see, is that when the state had not done renewals for a period of time, I don't know how long, but I understand it to be perhaps a couple of years, because you were still working on getting a new Medicaid system up and running. But you can see what happened very quickly after those renewals were resumed. That is when you saw the most substantial drop in enrollment from almost 66,000 to 47,000 down to 41,000 within a matter of a couple of months. And then it seemed to level out mostly with a little bit of a dip in the early part of 2019. And then, as Kanika pointed out, we've seen further drops just in the past few months that actually started around March or April. And part of that is actually that there's a provision that no longer allows states to disenroll anyone from Medicaid, and we'll talk about that in a moment. So children who would be transitioning, where their family had gotten an income increase, they were no longer eligible for TennCare, but they still were eligible for CoverKids, those kids would be passed over and enrolled in CoverKids. And that stopped happening after this freeze in the enrollment happened for Medicaid. But I want to give you a sense of how does your separate CHIP program, your CoverKids program, compare to other states. And I think without even worrying too much about the numbers here, you can see with the graphs that in most states, CHIP enrollment has nudged up or certainly stayed level. Texas is a huge exception. You see the decline in child enrollment in Texas, but then you also see the decline in Tennessee, as we pointed out on that more detailed graph previous to this one. Now, when we talk about kids coverage, we always talk about CoverKids, or CHIP, being a continuum of coverage for children. And in fact, CHIP sits on the shoulders of Medicaid, if you will. And across the country, what we see is that for every one child enrolled in CHIP, there are 4 children that are enrolled in Medicaid. So Medicaid is your larger program for covering kids, but the reality is that more and more we have begun to integrate how CHIP and Medicaid work together to make sure that it is seamless as families encounter these changes in income and shifts from one program to another. And again, here you can actually start to see that in the month of April, you had not yet seen an increase as a result of COVID when the public health emergency was declared on March 13th. Sorry, my mouse is really sensitive. I need to keep my hand off of it. But then starting in May, you're starting to see an increase in overall child enrollment. Now, I want to take a step back and say, okay, if we're looking at overall child enrollment over a period of time, how does Tennessee compare to the national average? We had reported at CCF back in May of 2019 concerns over there being a fairly significant decline in Medicaid enrollment across the country, in most states, at least in 2/3 of the states. But what you can see here is that in 2018, that is when there was that significant drop in coverage for children in Tennessee due to the renewals being resumed. So Tennessee saw a drop of 10% over the course of 2018, whereas the national average was 2.2%. Now, you did bounce back a little bit the next year as those people who lost coverage through the renewal process slowly got back enrolled. So you actually rebounded in 2019 by almost 5%, while the rest of the country typically was showing a decline of a little more modest decline than it showed in 2018. And then for the December to April period, because that's the last month we have these data from CMS, the rest of the country was pretty level flat, whereas Tennessee began to see an increase in enrollment of 1.3%. But clearly you can see how the enrollment has gone up and down, how that compares to the national average in this graph. Another way we look at coverage and how well we're doing in Medicaid and CHIP is to look at something called participation rates. And that's what you see here in the blue bars. The Urban Institute created a formula by which they look at children who are uninsured but likely eligible, add that to those kids that are covered by Medicaid and CHIP, or TennCare and CoverKids, and come up with an estimate of participation of uninsured children. How many are participating in Medicaid and CHIP? So you can see that your rates are here, have, as your coverage, as your participation has increased, your uninsured rate has also increased. So there is a correlation between uninsurance or insurance rates as well as participation rates. But as you can see, they're very sensitive to enrollment changes. So in 2017, we started to see participation go down to about 95%. It went down further in 2018 to just over 93%. And at the same time, you're seeing those drops in participation of children eligible for Medicaid and CHIP. You're also seeing your uninsurance rate grow from 3.7 to 5%. Now, we're going to be releasing some data, and I think that Kanika will be releasing some of the Tennessee data next week for 2019 as well. But this is where you definitely see that fewer kids were in Medicaid and CHIP, and as a result, fewer kids had health insurance. So we know that COVID-19 is driving enrollment now, and I think there's a typo on the top of that slide. It should say 2019. We are working on 2019 data for uninsurance, so I can't get what year we're in here, but when the various stimulus packages were passed by Congress, the Families First Act, there was stimulus money for state Medicaid programs, so that an additional 6.2 percentage points in federal funding is going to the states that qualify. One of the provisions for qualifying is that a state may not disenroll anyone who is enrolled in Medicaid as of March 18th or who subsequently enrolls. And that is basically for any reason other than the person moving out of state or passing away. So pregnant women have to stay enrolled. Children hitting age 19 have to stay enrolled. This is a pretty broad provision, and it was certainly more robust than we've seen in prior recessions when there have been some kind of Medicaid stimulus funds. Now, the thing is that the maintenance of effort provision only applies to your Medicaid program and those kids who are funded by CHIP but enrolled in Medicaid. That's why I showed you that first slide up front in the MCHIP program. However, Tennessee, I think it was precipitated by an executive order from the governor, requested and received federal approval. So it is not processing CHIP renewals, nor is it acting on any reported changes in circumstances that would drive kids out of the program. There are some exceptions to that. Again, if a child moves out of state, if a family requests voluntary disenrollment, but for the most part, that means that your CHIP kids are also being protected during this public health emergency. So I want to switch from the data to really talk about how do we do a better job of covering kids. We know that in 2016, our country hit an historic low rate of uninsurance for children. And since then, we have reversed that success story. We are going in the wrong direction. And as I mentioned previously, Tennessee was right there with other states, with the uninsured rate growing by 1.5 percentage points from 3.7 to 5.2%. But we've been at this a very long time. I've been working on covering children since 1994. And what we talk about as the secrets to success in covering kids really have not changed a whole lot over time. These are all still various aspects of how we run these programs in a way that helps us to reach all eligible children. You know, in this country, 99% or more of seniors are covered. We should do no less for our children. And I think that's a goal that we all share in terms of making sure that kids have access to health care. So this was an analysis that we did in 2013 with the Kaiser Family Foundation, or 2012. And it really looked at 4 states in different regions of the country to say to talk with state Medicaid agencies and stakeholders and say, what are the drivers of success in covering children? And one of the key drivers is that there needs to be political champions, at least one visible political leader who really champions children's health coverage. And from there, we know that we need to invest in outreach and public awareness. We need to engage community partners in this work. We need to provide consumer assistance. We need to help families get enrolled and stay enrolled. But those efforts are not enough, because underlying all of that are your policies and your procedures. And there are lots of options that states have to maximize eligibility, to make sure that we can reach more uninsured children. And there are lots of things that we can do on the system side of things to simplify and streamline the process for families. So I am going to move into talking about outreach and public awareness first, but I think we want to do another poll here, Kanika.
Okay, sure. So I will launch the second poll, which asks, are you engaged in outreach? So we'll just give folks a minute to respond. Looks like the majority so far is saying yes, but still have a few votes coming in. Okay, looks like the voting has slowed down, so I'll go ahead and end the polling and share results. So about 84% of you are engaged in outreach. So that's great, and we hope that this information will help you into making those efforts more successful.
That's wonderful. I'm so happy to see such a high percentage that are engaged in outreach, and hopefully give you some ideas as we continue on this presentation about some of the things that you can do or you might consider doing in addition to what you are already doing. So let's see if I can get back to my slide. So Kanika, I still see the poll up here. How can I close that out? Yes, I can. There we go. Okay, so first of all, I want to talk a little bit about what the federal requirements are for outreach. They're pretty slim. However, by federal regulation, your CHIP state plan, not necessarily your Medicaid plan, but your CHIP state plan must include your state's outreach strategies. Those regulations say that that outreach really should be targeted at any public coverage option, that it should not be focused just on CHIP or on the separate CHIP program. The other thing is that it can be financed at the CHIP enhanced matching rate. Now, the states share of CHIP expenditures is about 30% lower than for what they have to contribute to Medicaid. So that's a real boom. The minimum is 65%. And I meant to look up your CHIP match, but I think it's higher than that. So that the federal government would be paying more than half of this. However, when I go and look at the Tennessee State CHIP plan, it appears that this section has not been updated since 2010. So what the state tells us in that is that it does distribute flyers to all children through the schools, and that's a very good technique to use and should continue. But the state has not necessarily engaged in evaluating its strategies because it really only has the one. And I'll tell you a little story about when I started New Hampshire Healthy Kids. We actually started covering kids before CHIP came along. We were covering kids for 2 years prior to CHIP. And we had created an application where we ask on the bottom of the application, how did you find out about us? And we just listed the major groups, healthcare provider, hospital, school, child care center. There were about 5 categories. And so initially, more families indicated that they had found out about us through these flyers that they got from the schools. But over time, as more stakeholders got engaged in outreach, we saw that shift quite a bit so that healthcare providers and social service agencies became more of the predominant ways that people were finding out about the program. But this is one thing I would encourage you all as advocates to engage in a conversation with your state about examining its outreach strategies and updating what the state is doing, particularly now that we know that the uninsured rate has increased over the past couple of years. Okay.
Tricia, I'll just mention that Tennessee's current federal match for CHIP for fiscal year 2020 is 87.15%.
Great, thank you for that. Okay. So here's some of the things that, the overarching concepts of that we've known for many years. I think that Tennessee was one of the states involved in something called CoverKids and CoverKids and Families. It was a 7-year, 2-grant cycle project funded by the Robert Wood Johnson Foundation, and all the states were engaged in that. What we know is that outreach is an ongoing effort. It is not a one-shot deal. As Kanika said, I have an MBA, so I have a business background, and I can tell you there is no successful business that stops marketing its product when it hits its sales quota, or doesn't consider different marketing techniques in order to get its product to more people. So it's really important that we understand that outreach is a critical aspect of covering children that needs to be integrated in all that we do around Medicaid and CHIP. Now, as the number of uninsured children has dropped, though, we know that doing broad-based marketing, although it might be helpful in the COVID era, but beyond that, if we can find ways to actually target the uninsured and the key demographic groups that we know have higher rates of uninsurance, we can be more effective in those particular strategies. And in particular, we need to make sure that we disseminate straightforward materials that are clear and easy to understand, that help families know whether they might be eligible, that give them a better sense of what benefits their children will be able to receive, how do they apply, and in particular, where can they get assistance? We know that these application processes can be onerous, can be complicated, and it's really important that people get consumer assistance. And This is not something that I think a state agency can do on its own. We have to have state partners out in the field who do outreach, like 84% of you do. We need to use trusted messengers, particularly in key demographic groups. A good example of that right now is all of the hostile rhetoric around immigration and what that means for families of mixed immigration status. Even when the children are eligible, there's been this chilling effect. And so using trusted messengers who families will listen to and believe is really important in outreach, particularly when you're trying to reach those, quote, hard to reach populations. So I want to pause here on consumer assistance because I do believe that this is a critical element, and I think we wanted to do one more poll here, Kanika.
Yes, I will launch the third poll, and it is, do you provide application assistance? So if folks could just take a second and respond to that question, we would appreciate it. So it looks like the voting is slowing down. Just 5 more seconds. If you haven't gotten your vote in, please go ahead. Okay, I think we've gotten majority of responses. So I'll end that poll and share the results. And we see that 69% of the attendees do provide application assistance.
And that too is excellent because it really makes a huge difference. We know that it can be complicated to dedicate the staff time to helping families, but there are a lot of families who will not get enrolled unless someone is there to help them go through that process. So let's talk about some of the requirements here. We know that the Affordable Care Act wanted to broaden the options that families have for enrollment. So states are required to have online applications, be able to take applications over the phone, be able to take applications in person, or if there are still families out there wanting to use the old-fashioned paperwork method to apply on paper. Those are all required. And I will tell you that until Tennessee launched its new system, there was a period of time when the state did not have these application paths in place, and that in fact families had to go through the federal marketplace largely to enroll. But I think you've remedied that issue now, but those paths are really important. And as I mentioned, not only in the past, but also in providing assistance, states are required to do that both in person or over the phone. Now we know with COVID, this has impacted the in-person assistance. And hopefully we will get beyond that soon, but that is still an important aspect of coverage to try to maintain. There's also a requirement that states offer opportunities for individuals to apply at places that are not government offices, and that's called outstationing eligibility workers. I can tell you that we don't know a whole lot about how states are complying with this requirement. I think there have been times when a state might actually co-locate an eligibility worker at a hospital or an FQHC. And sometimes states say, we are empowering our community agents like FQHCs and hospitals to assist families, and therefore that's our plan for making sure that people are able to apply somewhere outside of a government agency. And in that regard, Tennessee does have an online portal for application assisters, which is great. Not every state has this. This is a really important mechanism for an assister to help a family, but also for the state to know that the assister is involved, that it's not just the individual. But these portals can become quite sophisticated and offer many other functions. I will tell you the most impressive system that I saw was in Kentucky, where with Connect, when they had their state-based marketplace, which they then changed, but now they're coming back to that, their online assisters were almost like, account managers, if you will, for individuals. And they got, the assister would get a prompt if someone was due for renewal, so that the assister could actually reach out to the individual family and help them stay enrolled. The other thing that Tennessee has now launched with your new system is online accounts. I can't say enough about online accounts. I understand that there are issues with connectivity, with the use of computers, but indeed, this is an easy way for families to monitor their own eligibility, and in particular, to do something like reporting an address change. We know that address changes are a huge problem in the Medicaid program because low-income families tend to move around quite a bit, and it's hard to keep up with those addresses. Online accounts offer an opportunity for that. Some states have gone as far as to create apps, smartphone apps, for both their application and their online accounts. This is an area I think that is ripe for further development across the United States. But the other thing is that we want to make informed decisions about how well our programs are working, and we need better performance data. So one of the things, and I've got a link in another slide here, to a series of performance indicators that states are required to report to CMS. Unfortunately, we are not seeing that data reported publicly. CMS has been reporting enrollment data across the state and has been reporting application volume, but it has not been reporting some of the other indicators that states should be sending in to CMS, and that includes call center wait times as well as abandonment rates. Abandonment rates are when someone waits, they were told they're going to be in hold 10 minutes, they're on hold 25 minutes, they've got to go back to work, and they hang up. And those tell us a lot about whether we have sufficient resources to meet the demand. And we also need to know more about what kind of assistance people are using. And we need to lived experiences with families so that we can share those stories to illustrate improvements that are in order to make the program work better. So let's turn and talk a little bit about community partner engagement. And in a moment, I think Kanika wants to talk a little bit about the work that you are doing in Tennessee. But community partners are, there's a broad list. I've included some of them here. I'm sure you would know that there are probably things that we missed, but these are all organizations that directly serve children and families. I think that is the piece that ties them all together. So if an organization actually serves children and families, it has a relationship and it can do more with that particular relationship. But these community partners, they need to be nurtured. They don't know all of the information about the programs on their own. And I think having community partner networks in the states is really helpful. So let's talk about some of the roles that community partners can play. So most of you are doing some kind of outreach, so posting and disseminating that information is really important. Sharing program information, putting widgets up on websites, you know, if your child is uninsured, check this out, go here to try to apply. Groups are actively educating clients. This is really important in the health provider world, where what's the first question you get asked when you show up for a healthcare appointment? Has your insurance changed? So this is a prime opportunity where you've been able to identify that someone is uninsured, and that is someone that we really should be working toward trying to actively enroll. I will say, when I showed you those participation rates earlier, that's the new report for the 2018 data, which is the most recent we have. It's going to be posted tomorrow on the Urban site, on the Urban Institute site, and there's a link in that slide. But what we do know is that in 2018, almost half of the 83,000 uninsured children in the state were likely eligible for Medicaid CHIP. So it's really important that we try to identify those uninsured children and help them get enrolled. So providing application assistance, renewal assistance, and then more importantly is that when community partners get really savvy at this, as they begin to know more about eligibility, and they can spot system issues. There will always be glitches in systems. You introduce a fix on one thing and it causes a problem on another thing, right? But when those problems occur, if you have this feedback mechanism working with your state partners, then you can potentially find out about these systems issues sooner rather than later. And one idea I've always had, I don't think it's been fielded in many places, but when states launch major new initiatives with their systems, is to bring in a cadre of application assisters and have them, you know, in a test environment, go through and flag things that don't look exactly right for them. But this feedback loop is really important. So in a feedback loop, the state is updating your community assisters with new information about the program when there's a change, whether that change be to the procedures, whether that change be to benefits. So that information is fed into the network, and then the network can feed back to the state where the problems are, or what's working well, or offer suggestions on how to make things better. So that feedback loop. And I think the state of Massachusetts, even though a lot of states roll their eyes at the state of Massachusetts, has been most effective in doing this for more than a decade. They have done annual trainings with their community partners, and they host regular meetings in different regions of the states to share information back and forth. I think we're going to turn to Kanika for a minute to talk a little bit about the work that's being done to support community partners in your state.
Thanks, Tricia. Yes, I'd just like to make everyone aware of our Insure Our Kids campaign. TJC launched this campaign in partnership with several other organizations across the state back in 2018. And the goal is to enroll every eligible child in the state in either TennCare or CoverKids. We have a growing list of really impressive partners that includes government agencies, healthcare providers, and nonprofit organizations that serve children and families. We provide communications toolkits that include flyers, social media content, and we have 2 animated videos. One is directed at parents and another directed at providers to share information about our TennCare and CoverKids programs in terms of who's eligible and what benefits they provide. And we also provide application assistance. We have a toll-free number that TJC staffs to help people apply, over the phone. And we have partner organizations, including the Matthew Walker Comprehensive Healthcare Center and Family and Children's Services, that also provide application assistance. So we welcome other organizations to join the campaign and help spread the information and the resources. And if your organization is interested, feel free to reach out to me, and I will put my email address as well as the Ensure Our Kids website address in the chat box.
Great.
Thanks, Tricia.
Thank you, Kanika. And if you're going to chat, we would love to have you share with us either a brief description, a bullet or two of the kinds of work that you're doing to assist families. Also, if you have a best practice, something that you have found to be the most beneficial, please share that in the chat with your colleagues across the state. I will tell you that I had a very robust outreach and community partner program in New Hampshire. We actually had 3 regionally based outreach coordinators in a very small state and an outreach director. And their role was to nurture our community partnerships. So they would offer a continuum of training. So it could be a very basic 101, here's who's eligible, etc. Or it can be much more in-depth for application assisters. You can also develop outreach kits that give state partners tools to deploy in their outreach efforts. It's really important to provide as much detailed demographic and geographic data that you have on the uninsured, because again, we're not just inviting the world in, we want to make sure that we cover uninsured children who do not have other resources. We actually created best practice checklists for providers, particularly FQHCs. Are you screening for eligibility? What do you do then? And then giving state partners the tools that they might need to actually push out more information, whether those be social posts, newsletter inserts, website widgets. Called the 100% Schools campaign, and that is where we partnered, or the state partners, with the schools in an attempt to identify every uninsured child and to at least make 3 attempts to contact that family to offer application assistance. So the way that it worked was the schools would be capturing that uninsurance information, and they would get the family's permission to share the information with the local community health center, and the local community health center would then contact the family. And if a state, fundamentally, if a school fundamentally did all of those things, then they were honored at an annual event with the governor as being a 100% Schools campaign, that they're attempting to get 100% of their kids covered, even though there are always some families that would not participate. Other things that you can do is to engage AmeriCorps, Vista, or other volunteers in the work that you do as well. Now, I would be remiss to really just suggest that outreach and consumer assistance is enough to get the job done. And it's really not, because all of these aspects of eligibility and enrollment tie together. Eligibility levels. We have 19 states that cover kids up to 300% or higher. Right now, Tennessee is at the national average, which is better than being below the national average at 255%. But that's an opportunity. We also know that CHIP reauthorization in 2009 allowed states to capture CHIP funding for lawfully residing immigrant kids, and 35 states do that, including some of your neighboring states that I've listed here. We also have the option to smooth out a year's worth of coverage for families by adopting 12-month continuous eligibility. These are opportunities here in Tennessee, and 23 states do in Medicaid, including the states I've listed, your neighboring states here. Then on the systems, processes, and procedures side, you know very clearly what happened with when renewals were resumed. Under the Affordable Care Act, states are required to really try to get away from paperwork. We have access to tons of electronic data these days, so that we can use that data to determine eligibility without requiring families to provide proof of eligibility. On the application front, real-time eligibility. If you have all the data you need, when someone applies, hits the button submit, and the system goes out and looks at these data sources, it can actually be enrolled immediately or sometimes in a batch process overnight. That's considered real-time eligibility. And states are required to try to gather that information to automatically renew people who are enrolled at renewal before sending a renewal form. Those are really important techniques to reduce the paperwork burden, and it's reduced both on families as well as state eligibility workers as well. Also, there are various ways that states can be more proactive in keeping their addresses current. I mentioned the online accounts and, an app for online accounts, but there's nothing to stop a state from somehow figuring out how to do an app just to update an address. So there are lots of things that you can do with technology. Forms absolutely have to be simplified. I heard stories of the renewal forms being 40-something pages in Tennessee. That's just way too much. We have got to do a better job of streamlining these processes so it's not overwhelming for families who get a 45-page form in the mail. Notices, I just don't know when we're ever going to get to a place where I can say, wow, we've done so much better with notices, and we put so much legalese in these notices, and they just are not easy to understand. A great project for stakeholders to work with the state to examine these notices and figure out how can you say things in a more streamlined, straightforward fashion that people will understand. The other thing that I think is important, and I hope that Tennessee has plans for this, but when you launched your new eligibility system, it is for Medicaid, and we now have about half of the states that actually offer an integrated multi-benefit application where families can actually apply for SNAP or TANF, sometimes child care. At the same time, they're applying for Medicaid. And that just means families are less burdened to go to different websites to apply for programs individually where they have to provide the same information over and over again. If you don't have a multi-benefit application, there's also a system in a way that uses the SNAP data to actually facilitate a Medicaid application. That's called Express Lane eligibility. So I just want to wrap up with what I see as being some of your prime advocacy opportunities. Getting better performance indicator data. This is where I had said that there's a link here to the performance indicators that states are supposed to be providing to CMS. It would be great for states to start posting this data at the state level if CMS is not going to share it. In that data is something called it's something that gauges the number of procedural denials. These would also be denials that the state could not make a firm eligibility determination. They don't know whether the child is or is not eligible because they didn't have all of the information that they needed. Knowing the share of those is really important, because if half of the people are being denied coverage or being disenrolled at renewal because of missing information, there is more we can do to remedy that problem. There's a link here too to some actionable reason codes. This was a project Mathematica did with a bigger project called the Maximizing Enrollment Project, where came up with a fairly straightforward list of reason codes that would actually discern this person wasn't eligible because they're over income, but this person wasn't eligible because we had a bad address. Having those actionable reason codes will tell you a lot more about the efforts that need to be made in order to keep kids enrolled and get them enrolled. We already talked a little bit about call center wait times and abandonment rates. You should be encouraging your state to work toward higher rates of real-time determinations and automated renewals. We do ask this data on our 50-state survey and report it for a variety of states. So you can see that some states actually are achieving over 90% of applications being determined in real time, and over 90% of renewals being conducted on an automated basis. And that is what every state should attempt to do. We've mentioned notices, we've mentioned multi-benefit applications, all on the to-do list for advocacy, as well as having a broader effort in partnership with the state that would support and sustain your outreach and community partnerships. And with that, I think we are done and have just a few minutes for some Q&A here.
Thank you so much, Tricia. That was really great information, and I'm sure a lot of people heard some things there that they can probably take to heart and incorporate in their work. So we did get a couple of questions. The first one asked in terms of in Tennessee, our TennCare and CoverKids are under the same application. And so the question is concerning the strategies that we're talking about. Are they any different than what we would use to promote and encourage enrollment in TennCare? I'll just mention, no, the strategies would not be different, but we do note that our CoverKids enrollment is not following the same trend as TennCare, and it could be because a lot of families think they don't qualify, not realizing that the CoverKids eligibility levels are higher. So it's really important that we market and raise public awareness separately about TennCare and CoverKids. And then another part of that question was why we're talking about CoverKids separately, as the differences only seem to matter in policy making and budgeting. Again, we're talking about it separately because the enrollment trend looks a little different, and we really want to make sure families are aware that there is a separate program from traditional TennCare that their kids may qualify for. Tricia, did you want to add anything in response to that?
Yeah, I mean, I totally agree that you should be marketing children's coverage, period. It's a little complicated when you've decided to name the programs two different names, because people think that those are two different things, and people think, oh, do I have to figure out which one I'm eligible for before I apply? So the more that that you're basically marrying the programs, the better that is, for sure. You know, the fact is that not all states are seeing the same trends in CHIP enrollment. And I think Kanika's right. The best practices would say that your material should say that a family of 3 or a family of 4 earning up to X amount, children would be, you know, may be eligible, just to make sure that people are not ruling themselves out. Also, I think there was a lot of confusion around the unemployment emergency boost, that $600 early in the year that went away at the end of July. Some states are doing more now. That does not count toward eligibility. And families may have looked at that. If you think you have 2 working parents, they're getting $1,200, almost $5,000 a month. They may automatically say, well, wow, you know, we're not eligible. So it's really important that you talk to working families and give those eligibility levels.
Thanks. We have another question that says, families were kept on TennCare during this COVID pandemic. How long are they going to be kept on regardless of income change and other eligibility factors?
Yeah, that's a great question. So the way that the maintenance of effort provision works is it is tied to the 6.2 percentage point bump in Medicaid funding. By the way, there's a 4.34% bump in CHIP as well. And that goes until the end of the quarter in which the public health emergency has ended. So right now, the public health emergency ends October 23rd. Secretary Azar may indeed extend it, so that'll give us more time out. But the maintenance of effort provision ends at the end of the month in which the public health emergency ends. So if Secretary Azar does not extend the public health emergency, then as of the end of October, families may no longer be eligible. And the question is, how are we going to handle that? We are very concerned that states are going to do, it's going to be sort of this mad dash that might resemble a lot of what happened when Tennessee resumed renewals. That all of a sudden the system is overwhelmed, that you don't have enough assistance, you don't have enough eligibility workers, and families can't get through to the call center, can't get information on what they need to do to keep their child enrolled, and they automatically get disenrolled. We are very concerned about what happens, and certainly we know that there are steps that states can take to mitigate mass disenrollment, and we would certainly encourage you to advocate with your state for doing it in a very sane way.
Thank you so much, Tricia. We are at time. I really do appreciate you joining us today and providing this really helpful information. And we will try to incorporate a lot of these tips into our ongoing efforts through our Insure Our Kids campaign and also at TJC and our regular client advocacy work. So again, if you have any questions, feel free to email me. We will share a copy of the recording as well as the slides after this webinar, and we hope you'll join us next time. Thanks, everybody.
Great. Thank you, Kanika.
Thanks, Tricia. Bye.